Hello everyone, my name is Romario Williams and I am a fourth year medical student partnering with Aspirar JA for their Men's Health Week 2021. Now, statistically speaking, men are said to have lower health seeking tendencies than women. That is to say that they are less likely to report to any medical facility if they are experiencing symptoms or to follow up if they have been diagnosed with any medical conditions. Now, the result of this is that men are more likely to die from common conditions because they normally present when the disease is far advanced and sometimes untreatable. One main example of this is prostate cancer, which is the leading cancer-related cause of death among the male population in Jamaica. This is partly due, as said before, to the fact that males tend to present when the disease is far spread and the cancer has already spread to other parts of the body, known as metastasis, but mainly by the fact that they avoid screening. And screening is really important as it helps in early diagnosis and it improves the outcomes of treatment. Now, what exactly is screening? Screening consists of various procedures and tests we can conduct, which can help us to diagnose the disease early before the presentation of any symptoms. Symptoms for prostate cancer including changes in your urinary habits, such as your frequency, whether or not you're urinating more at night, if there's blood in your urine, if you have to strain to urinate, if you have erectile dysfunction, which we as Jamaicans really like to have. So before all these symptoms present, screening is a way of diagnosing the disease, and that can really improve the attempts to treat the disease. Now, why is it that screening is frowned upon in the population? Well, it's due to the fact that one of the methods, the other is a blood test, but the main method that is used is the digital rectal exam, the dreaded digital rectal exam, which is where a doctor inserts a lubricated finger into the anal canal and feels the prostate gland for any changes in size, texture, consistency, etc., as these can be indicative of early changes which are associated with prostate cancer and other conditions, such as benign prostatic hyperplasia. But the diagnostic value it offers in possibly detecting cancer early is really important. However, with all the negative societal and cultural connotations, men tend to avoid this, and this is being reflected in the prevalence and the mortality rate of prostate cancer in our population. So my charge to the men for this Men's Health Week 2021 is to get screened. If you are at the age of screening, which is around the age 40, you are recommended to get an annual prostate cancer screen, including of the digital rectal exam and the blood test, prostate screening antigen, yearly. So we can, if there are any acute changes, we can follow up and we can treat it as early as possible to improve the prognosis. Because year by year, lives are being taken, families are being broken, and people are being forced to say goodbye to their loved ones long before they planned to, because of an onset of a disease that if it was caught earlier, the treatment would have been more successful. And for those who are so averse to the screening method and averse to the entire process of screening, and are averse to the point where they are willing to convince others not to do it and look down on others who do it, I have one question for you. Which one is better? One finger or 6 men bringing it back? That's something to think about. So get screened, stay healthy, and have a great day.